We are taking you live now to the Health Minister, Mark Butler. He's speaking about the decision to increase the eligibility for people to receive a fourth COVID vaccine dose. Let's listen in.
Of getting COVID again with this third Omicron wave. As I said, this is placing real pressure on our health and hospital systems. States across the country are reporting increased numbers of cases and increased numbers of people requiring admission to hospital because of COVID. There are now almost 4,000 hospital beds across the country filled by patients with COVID. That's an increase of almost 1,000 in just the last few weeks. And the number of people in intensive care units, or ICUs, is up just 40% in the past week or 10 days alone. And we're only just at the early stages, as I said. Now, being up to date with your vaccines is crucial to protecting you against the risk of severe disease and particularly the risk of hospitalisation or worse. As I said, even if you have had COVID before. There was a terrific take-up of the first 2 doses of vaccine in Australia once the vaccines finally arrived in this country. We have one of the highest rates of double-dose vaccination in the world. But what we know about the Omicron variants is that 2 doses of vaccine is simply not enough to give you protection, even if you have been infected. There are still more than 5 million Australians for whom it has been more than 6 months since their second dose, are eligible for a third booster dose but have not taken it up. I urge you to go out and get that third dose. It will provide you and people around you with more protection against this highly infectious subvariant BA4 and BA5. And for more than 3 months, over 65-year-olds and other groups as well have been able to get a fourth winter boost dose. But that, again, has not been fully taken up. More than 40% of people over the age of 65 have not yet had their fourth dose. Again, I encourage you to do that. Older Australians are far more susceptible to the risk of severe disease or admission to hospital under these subvariants. It is crucial that you get a fourth booster dose as soon as possible. Now, this morning I've decided to accept further advice from the Technical Advisory Group on Immunisation to expand the fourth dose through this winter to a much larger group in the population. Until today, the fourth dose was available only to Australians over 65, to Aboriginal and Torres Strait Islander Australians over the age of 50, and a range of younger groups at particular risk of COVID illness, including younger Australians with a compromised immunity. Today, that group will expand dramatically. There are 3 elements to this decision I just want to run through. The first is that from today, the Technical Advisory Group on Immunisation has recommended that all Australians aged 50 and over take a fourth dose of COVID vaccines. So all Australians aged 50 and over. ATAGI has also recommended that for Australians aged between 30 and 49 who feel that they want to take a fourth dose, that will be available to them, but will be an individual decision. It is not a specific recommendation of ATAGI. And the third element of the advice that I've accepted today is that the interval between doses of vaccine, or the interval between having been infected with COVID and getting your next dose of vaccination, has been narrowed from 4 months down to 3 months. From 4 months down.
That was Mark Butler, the Health Minister, speaking after Australia's Vaccine Advisory Group, ATAGI, recommended that fourth dose or a second booster for Australians aged between 50 and 64. The additional jab will also be available for people over the age of 30 if they do elect to receive it. That expanded eligibility will begin next Monday. If you'd like to keep watching that news conference with the Health Minister, you can do so. It continues on our Sky News Extra channel.